So just again, I'd like to encourage anybody that has questions to feel free to step up to the microphones and ask them. And thanks, Herb, for sharing your story.
Thank you for being here and listening, and hopefully we can increase awareness by just telling people.
Yeah, exactly. So you mentioned your first symptom of male breast cancer was noticing an inverted nipple that became prominent over the course of about 3 weeks. Did you ever feel a lump associated with it, or was it just the nipple changes?
It was just, I showered one day and looked at it and said, wow. And then, showering every day, I thought, well, I guess I better talk to the doctor about this. I had no idea what it was.
Yeah.
But,
And after your surgery, did you ever read your pathology report and see if they found a lump and what size it was?
Well, yeah, fortunately, my daughter Heidi was going to school at Wayne State in the pathology program at that time. So I had a lot of information available, and actually, we did a second opinion. From Florida, everything was sent to Wayne State, and I went up there for a second opinion. Mm-hmm. It was, I believe, 1.6 centimeters. I believe.
Okay. Yeah. Now, being the father of a PA, I have to ask the question, did you want to see your specimen?
No.
Did Heidi want to see it?
There are times, without a doubt. There are times when you trust your daughter. Not very frequently, but there are those times.
All right. Now, as a survivor, how often do you return to your doctor for routine checkups and mammograms?
Well, the first 4 or 5 years was every 6 months for a mammogram. And I see my oncologist every 6 months, and now it's down to once a year for both of them.
Okay.
And I'm not so sure I'm going to continue with the mammograms because, there is some controversy of whether they can actually do more damage than good. And it's been 12 years. Maybe it's time just to go every other year for a mammogram and every 6 months to the oncologist.
Yeah, well, that sounds like a conversation to definitely have with your doctor and come up on an agreed plan. Looks like we have a question. Oh, a couple questions. Excuse me. Whitney.
I'm from Jacksonville, North Carolina, where Camp Lejeune Marine Corps Base is located.
Yes.
And I know a couple of years ago, it was on 60 Minutes, where several Marines had developed male breast cancer. And there was they found in the 80s, I think, that there was a contaminated water for on base. Right. And so I was just curious if during your time, meeting other survivors, if there's any other link like that you've heard of?
No, but Camp Lejeune is sort of different, an entity onto its own, in that it was more than 2 or 3. There were very significant number of Marines diagnosed with male breast cancer. And it was attributed to the water they were drinking on the base. I tried to stay away from, our organization tried to stay away from that issue. This goes back 10 or 10 years, that it was becoming political, very political, because of the costs involved in treating the men. But nowhere did I ever read that they did an assay of the number of women on the base that developed breast cancer. Now, if that high percentage of men developed breast cancer, if it was strictly the water on the base, then the female rate should be significantly higher as well. And that was never addressed. So I have tried to stay away from that issue.
Thank you. Well, thank you again for your talk. I had a question about bilateral prophylactic mastectomy for men on the other side. In your research, has that come up? Do the men get
very
both?
Seldom. Very seldom. It is an option. Normally, it's just a piece of tissue for men. Eventually, after they're diagnosed and they get to realize, they can do without it. But it takes, I don't think there's as much potential for the other breast in men as there is in women. Okay. I don't believe out of all of the men that I have stories on that there is a double mastectomy.
Mm. Thank you for sharing your story.
Thank you.
So Herb, you mentioned that the surgery you underwent was lifestyle conserving and not a breast conserving approach. Why did you choose this approach? And 12 and a half years later, do you think it was the right choice?
Well, it wasn't, I was very, very fortunate. The surgeon was a friend of my family doctor, and he took 45 minutes to sit down with me and talk and learn about who I was, and that I played golf 5 days a week, and that he then looked at it and said, you know, if we do a full mastectomy, the chances of developing lymphedema. Now, I know all of this afterwards. At the time, but if we do a full mastectomy, this could prevent you from playing golf in the future. If we can put it through the medical system by doing a sentinel node evaluation and modified radical mastectomy, that should decrease the potential for lymphedema. And if we have to go back in later, then we should be able to push it through. Mm-hmm. That was 12 and a half years ago. I don't think many surgeons today take that time unless men start to show an interest in their diagnosis and their treatment. Then they will spend more time with them to see what they want and what the best possible outcome could be. So I was very, very fortunate.
Have you pursued any additional molecular genetic testing, such as the BRCA1 and 2 testing? And why did you pursue it, if you did, and what were the results?
Well, this is sort of again Heidi pushing that, but at that time she was working at Roswell Park and was able to get me into a BRCA screening. Now, that wasn't for my interest as much as I have 2 daughters. So it was more for them to know and what they needed to do. Mm-hmm. Yeah, that was the only one I've done.
Nice. And was it BRCA1 positive?
No, it was BRCA negative.
Oh, BRCA negative.
Yeah.
Excellent.
Which is still only an 80% chance, you know, but at least it gives them the opportunity to establish baseline mammograms at 40 and go from there.
Perfect. Can you describe some of the challenges and obstacles you've encountered with promoting the 3rd week of October as Male Breast Cancer Awareness Week, and how you think PAs in particular might be able to help with this endeavor?
This one is a tough one because here in the States and in Canada, everything has become profit-driven. So you're not going to get the breast cancer organizations and foundations to support it. Now, when we started out, originally back in 2010, Congresswoman Jeannie Brownway from Florida was going to put a proposal to the U.S. House of Representatives. And before she could do it, she developed cancer and ended up resigning her position. And the following year, the U.S. House of Representatives changed the fact that they would no longer accept proposals for proclamations. It had to be done at the state level. So we began doing that at the state level, which is fine. A lot of states would do it, but that has to be reviewed and resubmitted every year. So now you've got 51 states that you have to go back to every year, and it dwindled down. We need a unifying organization to say, hey, men get breast cancer, here's some money to support it, and go from there.
Mm-hmm.
I don't know. So we have a question from the live stream.
Oh, excellent.
I have worked at several different hospitals throughout the country, both military and civilian. Many of these institutions have women's hospitals dedicated to women's morbidities, but I don't believe that I have ever seen a men's hospital dedicated specifically to men's morbidities and the psychological and sociological needs that are specific to men. Do you believe that if men's hospitals dedicated exclusively to men's morbidities existed, that more men with diseases such as male breast cancer would feel more comfortable and be more open to speaking about treatment?
I think that is a possibility, definitely. But also, I feel that if the female breast cancer community would recognize that it is a man's disease, and when a couple goes in for a mammogram, they always assume it's the woman and embarrass the man when he stands up. So if you can overcome those things, it's going to be easier for men to do. So it's awareness in the medical community to not treat everything as pink, maybe put a little blue into it. I hope that answers the question.
Herb, you state that a low incidence of male breast cancer makes it difficult to conduct randomized trials. There are thousands of rare diseases where only a handful of people around the country or even the world are affected. Sometimes the FDA makes allowances for clinical trials in circumstances like this, where there are just not enough participants for a randomized trial, but treatment is critical to survival. Do you ever foresee the FDA giving an allowance like this to the male breast cancer population?
Well, first of all, whoever is to put that through to FDA would have to be convinced to push it. And again, because the incidence is so small, there's only 2,300 men in the U.S. diagnosed annually, and only 450 men that die. That doesn't mean anything to the breast cancer organizations or medical community. It means a lot to the guy who receives the diagnosis. But there's not going to be I don't know how you get to where you can push for somebody to step forward to optimize male breast cancer. We have trouble even trying to get symposia, or we had one put in Australia was really good. We've tried several times here in the U.S., and they've all been rejected at the big San Antonio Breast Cancer Symposium, ASCO. It's always been rejected, and it becomes discouraging that nobody wants to help promote it. I don't know where the answer is. We will get there.
Question from the audience?
It's a question and a statement. You should definitely trust your daughter more often. And secondly,
I don't know.
secondly, your counterpart that was supposed to join today is also a male breast cancer patient from MD Anderson. So him and his wife both went through that experience together. And in talking with him, we've actually got two clinical trials open at MD Anderson, which also include men. So it's happening, but slowly, but it is there.
So the two gentlemen that you showed pictures of and discussed as sort of getting the ball rolling on male breast cancer
Right.
awareness, Brandon and Joe, they were both younger than the typical male breast cancer patients.
By far, yeah, that's why. They were 48 and 38 at the time of their death. That's 12 years ago. But again, Joe was diagnosed stage 4. And this is all related, and Brandon was also diagnosed stage 3-4. It all goes back to awareness. Neither one of them knew anything about breast cancer in men. And it's all about getting men to notice any change, get it looked at. And if you're not happy, get a second opinion. And learn all you can about the disease. Yeah.
Do you think it's worthwhile to have a campaign like women do for a monthly self-breast exam, but for men?
Out of the Shadow of Pink, Kathy Reed, and we forward this on our Facebook page every month. She has put out a reminder, check your boobies, for men every month. And I just put that forward. Yeah,
Perfect.
It's just awareness. You're not going to go for screening for men. There's not enough cases. But just be aware, because the majority of the time you're going to feel it or see it. And we're men, oh, that's interesting. Wouldn't worry about it. Yeah.
All right, and then last question. What would be your final take-home message to your audience of PAs in the room?
Well, if you know and you learn of any men being diagnosed, kindly tell him that he's got 3 or 4 things he has to do right away. And the first one is to eliminate that feeling, and this also is probably true for female breast cancer patients, you've not done anything wrong, you're not abnormal, and you're not going to die from a woman's disease because 75% of us live normal, productive lives. So it's a mental state they need to get into and get rid of the negative. Also, secondly, eliminate the male macho stigmatism that you are everybody's rock and you're going to get through this alone. Ain't going to happen. I can tell. You need to accept everybody's support that is offered because it's important for you to accept it and for them to give it. So you can work as a team and work together. Your outcome is going to, and journey is going to be much smoother. Thirdly, you got maybe 24 hours to feel sorry for yourself. And then you need to get off it and start to learn everything you can about breast cancer in men. Because within the next week or two or three, clinicians are going to make decisions that are going to affect the rest of your life. If you know enough to be able to discuss with them what's going on, they're going to be far more interested in helping you learn more about it and seeing that your outcome is the best possibility. If you do nothing, you're just a number on a paycheck to them. I would rather have them interested in me. And finally, remain positive. It's difficult. There'll be days you don't think you can. But a positive attitude is what really helps you get through it.
All right, looks like we have one more question. Tana?
So first of all, I just wanted to thank you for bringing attention to an unrecognized and unknown disease.
Thank you.
And also to let you know that the AAPA each year puts out a member calendar, and next year for 2018, we will put the third week of October as Male Breast Cancer Week. So
Thank you.
Oh, excellent. Thank you so much, Herb.
No, I have cards for our website available if anybody wants it. But it's just malebreastcancer.ca. Thank you so much for that.
Thanks, everybody.
Thank you.